So my name is Bhavna Varma, and I am semi-retired. I retired as the CEO of the United Way in Kingston. And I've worked in nonprofits, mostly with the United Way movement, for over 30 years. And I got involved with the issue of homelessness when I moved to Kingston for this United Way. And I was visiting agencies. And one of my visits was to the Ryandale, which was a shelter at that time. And when I walked in the door, there was a baby seat at the table. And it just shocked me to think, because somehow in my mind I had not related this to families. And there was the fact that kids and babies are part of this homelessness thing really made me determine that we needed to do more as a community, that no child should be in a shelter.
So my name is Connie Glenn. I am the City Councillor for Sydenham District in Kingston, Ontario. I'm also the new chair for the Housing and Homeless Advisory Committee here in Kingston. I'm a member of the Southeastern Health Unit, so I sit on their board. And what got me here is I am a healthcare provider, and we're seeing increased amounts of disability, and that's one of the key factors that's leading to the increase in homelessness. So it's something that I can't, in good conscience, not be involved in trying to find a solution for.
So my name is Skylar Frank. I'm the Ward 11 City Councillor for the City of London. I'm a first-term councillor, so I've been in the role for 2.5 years. Yeah, so again, with my social justice background, I'm a strong believer in a diversity of tactics, and so I don't think there's necessarily one right way. I think it's, if anything, you need to do a bit of everything. So meet people where they're at, so one-on-one, help at the community level, and then also provincial, national. You know, I think a lot of the time in policy, I think about municipal, provincial, and federal. But I do think it's important to come at the community level because every community experiences poverty or homelessness differently. So people in rural cities, people in northern Canada, people in London, Ontario, and urban centre, all experience poverty and homelessness differently. So we have to have a unique response to it.
Okay, my name is Greg Ridge, Gregridge. I'm the City Councillor for Kingstown District in the City of Kingston. So whenever I think about policy development and policy framework, I think broadly within like our levels of jurisdiction, right? So you talked about nationally, then there's provincially, and then there's community or the municipal level, right? And so all of those systems in different ways intersect. There's a lot of interaction between them. And one of the interesting policy choices that was made at some point in the past with the provincial and municipal government is that while the province has legislation and regulations around how social services are implemented in Ontario, they're actually implemented by the municipality, which is unique, I believe, in all of our federation through provinces and municipalities. And that gives social service operators, if you're developing policy framework from the municipal level, more of an opportunity to look at those different pieces. For example, housing prioritization list, right? Or what is our shelter policies? Or what are policies around encampments? And as a result of that decision that was made in the past, municipalities in Ontario in particular have more nimbleness when it comes to how they can develop policy and implement it on a local community level.
You know, we know as healthcare providers that there's a need to deal with the individual and their challenges, their issues. But what's that old saying? No person, no man is an island. We're social creatures. Without community, we don't do well. Even the most introverted individuals, you know, want to have relationships. So this is where community comes into play, and we want to feel like we belong. That's the same for all of us. We need our in-group, the people that we can talk to, laugh with, have a meal with, all of those things. That's what community brings to us. So a community response is about that. It's about embracing all of us and finding that place where we feel like we're home and we fit in. So we're talking housing, but I've said it more than once. What we're talking about isn't a house, it's a home. It's a place where I can be, where there are others around me that love and care for me as well. So that's why we have to pull away from simply talking about the population, which is really cold, and the individual, and say, it's all of us. I think we do. It's a systemic problem. When we as individuals vote to put people in, when we advocate for policies, that's us participating in democracy. And democracy is messy. I totally respect that, but it's the best form of government we've got. And if every citizen is part of democracy, that means we all bear responsibility for the outcomes. And people will say, oh, well, I didn't make that decision. No, but you voted for the person who did, and you decided to speak or not speak about that issue. So we all bear a little bit of responsibility, I'd say.
I think the most effective advocates are people that have researched what they want, have looked for previous examples of it in other municipalities, for example, and reach out to individuals, and they build a personal relationship. I think that goes a really long way towards efficacy. And if you can't get the exact ask that you're originally asking for, then you can continue the conversation to try and advocate for additional change at very key opportunities, which I think the best advocates are the ones that I've worked with who I, even if I have disagreements with them, and I often do, that they are very, A, I like them, and B, that they know when to ask and how to ask. I think those are great examples, and those are often done more quietly, like they're very much on the personal level, as opposed to one I might say might be more poor, where the advocacy is not done directly to the policymaker, but is done through other means, for example, social media. And so then when we're talking about the converse of that, it would be that they don't have an understanding of what policies have been introduced. They don't have an understanding of jurisdiction, and they don't have so you're talking about, for those who are asking, federal, provincial, and municipal responsibilities, and as they're defined constitutionally. That's really important. And they don't have an understanding of what the limitations of resources are for the local level of government.
Mm-hmm. Yeah, again, there are so many different agencies, groups, commissions working within London who are trying to address homelessness and healthcare issues in different ways. And so I think one of the benefits, again, is understanding what everyone is good at, what everyone's skill set is, what everyone is able to provide to the community, because some places, might have 10 beds for women, and other places might have 100 beds for any gender. Figure out youth shelters, figure out who has good mental health support, who has a crisis center. So again, having a diversity of tactics, having niche different groups being able to fulfill the needs of our community and offer those supports, I think all of that is good, and mapping that out and figuring that all out. I think one of the drawbacks is there's too many cooks in the kitchen. So with that many different people, we have all these, so we had those 3 summits, they came up with a plan, and now we have all these different roundtables. So we have an encampment roundtable, we have a strategy and accountability roundtable, we have a funders roundtable, a developers roundtable, a business roundtable, and that's on top of all the other existing groups that were meeting in different networks. So as a council member, it's sometimes hard to keep track of everything and who is responsible for what. And it's sometimes hard to be able to communicate that back out to the community.
I would say working at the community level, it's important to take the time to find common ground, and that takes time sometimes, because we have to make sure that people feel heard, that there's no finger pointing, because there's no one, when there's a challenge, sometimes it's easy to point your finger at this agency or that person. If we take that away and take the time and let people be heard, find the common elements, and then move forward, And sometimes I find, firstly, the making sure people are heard can be take a little more time than people are comfortable with. But also the moving forward. Sometimes we get frozen in, well, what if we do it wrong, right? Or we're not ready to make this change. So I think that whole concept of change management is important in a community, to appreciate that if we want to make change happen, we have to do things differently. We can't do the same thing as we know and expect different results. I think also with adult homelessness and with food security, we're at a stage where everyone has different theories of what's the best way to approach it. So how do we find the common elements within those? Because some of them are very different from each other. So how do we find a way forward, recognizing that some people have really strong opinions of how we should be moving forward?